Hi, my name is Meyer, and I'm going to discuss mandatory nutritional counseling for health insurance. I believe people need to take responsibility for their health. First, I will discuss the agenda. We will be discussing mandatory nutritional counseling, including how the health of Americans is declining, how insurance companies are paying for lifelong disease treatments of individuals, and how there's an increase in prescription and medication costs. I will also discuss solutions and budget plan. I will be ending with conclusion and any questions to answer. First, I will discuss how the health of Americans is declining. A study from the Center for Disease Control and Prevention showed in 1985 no state had an obesity prevalence greater than 14%. By 2010, every state had prevalence of 20% or higher. This is sufficient evidence that an American health is among the decline. It is time individuals become responsible for their health. Next, I will be discussing how insurance companies are paying for lifelong disease treatments. Mandatory nutritional counseling will help in preventing disease through education, reinforcement of food choice. Chronic disease has a lifetime of implications. A study showed that in 2006, 84% of all healthcare spending was for 50% of the population who had one or more chronic medical condition. Chronic medical conditions are affecting too many Americans. With the health decline comes an increase in medication and prescription costs. Medication use has become society's quick fix. Medication use has an emphasis on treating the symptoms of disease, not finding the root cause of the disease. This has consequences of increased medication and prescription costs to insurance companies. Mandatory nutritional counseling can prevent disease from acquiring further, decreasing prescription usage and cost. A 12-month study of prescription sales from the IMS research firm showed the total sales of Lantus diabetic medication from April 2014 through March 2015, the total sales of $9,145,153. This medication would not have been used if diabetes were prevented, delayed, or cured. Outcomes of mandatory nutritional counseling include improving the health of Americans, teaching better food choices, and a reduction in prescription and medication costs. The impact of mandatory nutritional counseling can help prevent obesity through food choices. Obesity has continued to impact the individuals around us. An increase in American obesity is an epidemic. Proper education and nutrition is key to the prevention of disease processes, obesity, and an increase of medication and prescription costs to your insurance company. In the budget, it includes materials, nutritionist salaries for 2 full-time nutritionists, project manager who will oversee the project, hardware such as computers, training staff with a total budget of $164,000. In conclusion, implementation of this project will decrease medication and prescription costs for insurance companies, prevent lifelong disease treatment expenditure, and improve the health of Americans through healthier food choices. Any questions? Thank you.